So thank you for joining, everyone. As I said, this is the second in a series of executive sessions that we're having about what executives need to know about the Spring 21 upgrade. I'm Dr. Bob Murray, Chief Medical Informatics Officer for NextGen Healthcare, and I have with me Sarah Green, the VP of Commercialization. So today's webinar is going to be fairly short, with lots of time for questions, but you will certainly be out of here in less than 30 minutes, and it could be quite a bit shorter than that, but this time is for you. The idea is to make sure that the executives on the phone have a good understanding of what is in the Spring 21 platform at a very high level and why they need to upgrade, what it means for them. And then we want to get into the details of how the upgrade process is changing. We're learning from what we've learned from our beta clients and early adopters, as well as just the new attitude that we want to bring to the upgrade process. And so Sarah will talk to you all about that. Okay, so at the very highest level, the Spring 21 release of NextGen Enterprise is a major release for two different reasons. The bigger one is that it is the opportunity that we're having at NextGen to bring together as an integrated platform both hundreds of millions of dollars of internal R&D that we have been doing over the last couple of years, both within the platform itself as well as the surrounding applications, and the applications and the capabilities that we've acquired over the last couple of years. And so Spring 21 is able to bring all of that into a single integrated platform that is really ideally suited for the ambulatory care that all of our clients provide. If any of you have talked to your account managers or account executives recently, you might recognize these kind of 5 columns. This is how we like to talk about the needs that practices today have in the ambulatory space. And the major need that they have, of course, is to keep their patients engaged, to recruit patients, to retain them, and obviously to take good care of them. And so one key feature in the Spring 21 platform for that is, of course, the brand new portal. We acquired a company called MedFusion. They had a portal. We have lots of clients on it already. But everyone who upgrades to the Spring 21 release of NextGen Enterprise, if you're on the legacy portal, you're going to get upgraded to that MedFusion portal. That's going to allow a much greater level of patient engagement, both as soon as you upgrade as well as in the future as we roll out more and more capabilities on that platform. All of our clients need to keep their clinicians, their providers energized, and we have to have a product that's usable, and there's a number of significant usability improvements in the provider and clinician workflow within Spring 21. And we also have to give tools to align those incentives to make sure folks can be incentivized to do the right thing in the system, to chart what they need to chart, et cetera, and there's new capabilities for that as well. Of course, if there's no money, there's no mission, and so we have to continue to press our advantage in terms of practice management system and let you control and understand your financial outcomes. And so there's lots of good practice management as well as analytics capabilities in Spring 21. We can talk about those if you want. Many of our organizations are moving up the risk ladder and entering into all kinds of new payment deals or seeing new opportunities in their space. And so both with population health analytics and without it, there are new capabilities that Spring 21 brings to bear in terms of bringing that information into action, either at the administrative, the executive level, or at the point of care. And finally, we are offering that all ambulatory practices need to be able to exchange data with, at a minimum, their corresponding inpatient facilities with lots of other ambulatory practices. And so the new interoperability capabilities that Spring 21 brings to bear, ability to import lab results, the ability to have APIs that third-party apps can call or patients can get their information, are all part and parcel to Spring 21 release. And so that's the big reason why your organization should be taking a very close look at this and planning to upgrade. But the other reason, of course, is that many of you are just going to have to take this upgrade for regulatory reasons. If you are have any MIPS MACRA providers in your organization, you will need to take this upgrade. If you're doing CPC Plus or Primary Care First, you'll need to do this upgrade. Many ACOs requirement. There's lots of other reasons why you need to take it. For all of those reasons, the last possible date, now this is always subject to change, but as of now, the last possible date you would have to be upgraded to Spring 21 would be December 31st of 2022, so 18 months from now. And so we want to make sure that you are thinking about this at an executive level now, picking the right time for you to upgrade and starting that process off in a way that Sarah will outline for you. All right, Sarah, it looks like you're going to maybe take this slide and then to help us through what are some of the changes that folks can expect in the upgrade process.
You're exactly right. We're trying to make some changes with this upgrade to make sure that it is as valuable as possible and as successful as possible. Because like Bob mentioned, not only is this something that many of you have to do from a regulatory standpoint, there's a lot of really good stuff to get out of it, including that new patient portal, which the majority of you will be doing in a single project, right? Those of you that are using our legacy portal, FKA NextMD, will be moving to the patient experience platform, the new MedFusion portal, and we'll be doing that in a single go live event, right? So we know that we need to put structure around this process to make sure it's successful for everybody. And that's one of the primary things we're trying to do here is shift this from what has previously been a very task-based process, right? You open a case, you say, hey, we're ready to upgrade our test environment. We do it. We go back and, wait for you to tell us when you're ready to take the next step. Instead of being that kind of transactional process, we want to make it project-based. It requires a project to install a new portal, but it also should require a project to do an upgrade, right? So we want to make sure we put that structure where there's a clear expectation setting, requirements, establishment, and beginning, middle, and end of the project so we can make sure everybody's moving right to left really successfully. In order to do that, and in order to make sure all of you that need to make this move in the next 18 months can do so successfully, we are putting more resources in place to help you guys be successful. That's operational resources, again, to make sure we have kind of a program structured on our side to make sure folks move through this effectively. We need obviously implementation resources associated with the new portal. We're bringing together a lot of project management resources, again, to run this upgrade like a project versus something that is task-based, as well as technical resources to make sure all of the technical requirements are met on our end as well as yours. Our goal is to help drive the upgrade process, right? Set the expectations, verify and validate the upfront prerequisites, and then help make sure there are interim milestones that we're working through together to result in that successful go live of either the upgrade or the upgrade and the portal or any other projects that you're doing in association with this move. That's how we're changing. How we're asking you to change with us is really kind of twofold. Number one is planning ahead. Like I was saying before, the upgrade, while your teams have probably been planning for it, we don't necessarily know about it until you're ready to get started. That has been the nature of our upgrades in the past, is you call us when you're ready to do something, then we do it. Because we have so many folks that are going to be doing this, and because we're going to be running it differently with more resources coming forward on our side, we need to be able to plan ahead for those resources in order to make sure we can support you in being successful. So even if you have no idea when you want to start doing your upgrade, start having the conversation now so we can walk you through all of the things that we know about it that you need to consider in order to plan the time that makes the most sense for your practice, right? So plan ahead is really the theme here. We will help you with here are the expectations for the project. Here's what the timing looks like. We'll lay out those milestones, like I was mentioning, to help your organization stay on track. And really what that comes down to is, like Bob mentioned, our deadline as it currently stands is the end of next calendar year. And many, many, many of you will have to meet that deadline. And we want to support you in that. And make it, again, a productive experience. Get the real value out of what this upgrade has to offer beyond just the regulatory requirements. And so in order to do that, we have to have the right resources, and you need to partner with us. That's the other component, is commit to the project, have the conversation with us from a project planning standpoint, bring the right resources to bear, and then work with us along the way. This is going to look like conversations between executives about milestones that are upcoming if milestones get off track. Now, I'm going to get into that into a little bit more detail in later slides, so I'm not going to steal my own thunder, but keyword milestones, we're going to talk about that here in just a second. Here is how you get into the flow, right? You need to have a sales conversation and make sure that whatever you want to wrap around this upgrade, whether it's a $0 SOF because you're just doing the upgrade, or you want to buy services, you're doing other products in association with this, whatever that is, have your sales conversation. But in order to get the project started, here's what it's going to look like. it's going to start with an executive sponsor call. And this is a little bit different than how we've run things in the past. But what it's basically going to look like is you are going to get on the phone with me or someone from my team where we can lay out, these are the expectations of a project. This is what we will bring to bear. This is what we're asking you to do. Here's what timelines look like. And we're going to agree on what those expectations are, right? So some of that is prerequisites, that we'll lay out and make sure it's very clear what needs to happen. And that will allow us to assign that kickoff date, right? The kickoff date is when you can assign your production date. This is how the project will roll forward. We will then assign our project team prior to that kickoff date, and then we'll kick off the project. This isn't rocket science in terms of running a project, but it is a little, well, it's not a little bit, it's way different than we have run upgrades in the past. And we think it's going to result in much greater success for everybody, but it will feel a little bit different along the way. Let me jump to my next slide. Nope, I'm gonna back up. Something that I wanna call out here is in that executive sponsor call, one of the things that we're going to talk through is the milestones of the project to make sure that the leadership of both our organizations, so you and me, for example, are aligned on what is going to happen in the project. Because if those milestones start to get off track, what you can expect is that I'm going to call you and we're going to have a conversation about how we get both of our teams back on track, right? And that's why the executive sponsor call is really important, that it truly is an executive from your organization who can affect change, right? So let me give you an example. If we are a week before the end of integrated testing and no testing has occurred, I'm going to call you and we're going to have a conversation about, okay, what do we need to do to get testing back on track? Are you going to have your team work over the weekends? Are you going to have us support you in that? Are you going to delay your go live because we're missing the milestone? Okay, that is the layer of detail we will get into in that executive sponsor call. So those expectations are set up front. So by the time I'm calling you later on in the project, which again, hopefully will never happen, but if it does, that way we're on the same page about, hey, here's what was supposed to have happened, and here's what we are going to do to put a plan in place to get back on track, right? Because when we're talking about moving hundreds of clients onto the new version by the end of next year, we have to be really tight on our timelines, because if we start to stretch them, if we miss our milestones and it starts to affect our go live date, it's not as simple as saying, well, we'll go live next weekend, because there are going to be a lot of your peers who are signed up for those go lives next weekend. So if we're starting to miss milestones, it may be a while out before we can get you another go live date, which again is why we're putting all of this structure in place to make the project successful every little step of the way. So it's not something that any of us are surprised by when we're heading into go live time. Okay, I'm expecting some questions on that. So anything you have, write it down and we'll be sure to address it. Prerequisites on teams. Again, this is the type of stuff that we will cover in the executive sponsor call. We can get into a much deeper layer of detail, as well as talk about your specifics for your organization. But ultimately, we've got an upgrade project and a portal project that for most of you, we will be running at the same time. That the structure of the project, we will bring forward one project plan, right? We're not going to have you manage two different things independently with different milestones. It will be one set of milestones for anything that you have going live on that single weekend. But each of those areas of focus have different people requirements, right? So you need a project lead, you need the clinical staff, you need the technical team. There's some details about that on here. I want to make sure we have time for questions, so I'm not going to go into too much detail here. The thing that I want you folks to know, because this is an executive webinar, is that executive sponsor role is really important. We have had a couple conversations early on where folks have said, well, maybe I'll have my application lead or my project director, and every organization is different. So if that is appropriate for your organization, fine. Ultimately, what we're looking for on these executive sponsor conversations is someone who can be a decision maker, someone that can be this final go, no go conversation that we're talking about, someone that can affect change if we need it, which is why we're partnering you with the same level of influence on our side, right? So if you and I are having a conversation about what do we need to do to get back on track, you can affect change in your organization and I can affect change in mine, right? That's the idea of these conversations, so we can really make sure these projects move forward at pace. Here's the summary. I wanted to leave time for questions. Ultimately, we are committing to a better upgrade experience. We are using this regulatory requirement as an opportunity to improve the experience overall, and we're asking for your collaboration to do that. We got to do it together to make sure we can move this forward. And the main thing I want you guys to take away from this is work with us to plan ahead. Your next step is, if you haven't already had a conversation about your upgrade, start it now. Even if you're not planning on doing this until the end of next year, that's fine. Just having the information, having the conversation well in advance so we can plan ahead together is the goal here. All right. I see a little red dot that tells me there are questions over here. So let's open those up and have some discussion.
There's a couple that I answered in writing, but feel free, Sarah, to chime in on either one of those if you like. And anyone else who has questions, by all means, submit them into the Q&A panel in WebEx, because we have a few minutes to take all of those.
Excellent. So I'm not sure if everybody can see the Q&A, so I'll just read these out. Can the recording be made public? Yes, we will record this. We'll share it. Anybody who's registered for this will send out the recording so you can share it with your senior leaders. We'll also have more of these. They're not scheduled quite yet, Bob, keep me honest. But we will plan to have more of these, run the recordings again, whatever that is, because we know that this is important information to get out to the leaders of your organization.
It's worth saying just on that point that we have these executive type sessions, which are fairly short, but we also have deeper dives for your operational teams, your technical teams, where we share quite a bit more detail about the project plan and what are the actual, software prerequisites and hardware needs and, yada, yada, yada. And we plan a whole series of those. So your teams will be kept informed at the data that they will need. And all of this, of course, is notwithstanding your actual project plan once that starts. But these executive sessions are for high-level questions and just making sure that you folks are understanding what is the task ahead.
Absolutely. The next question here is, why are there no more 2021 slots? And Bob, you answered it perfectly. We are constantly evaluating our capacity, but here's what's going on in the background. Because we are developing this new process, right? We want to make sure that it's really good before we take it out to 100 clients in a month, let's say. We are doing our best to go slow and intentional at the beginning in order to find any kinks in the process, any bugs in the software. We're trying to take the bruises ourselves, is the right way to think about it. And in order to do that without creating more frustration down the line, is we're keeping our capacity really small in the short term. Once we get our process dialed in, once we learn the things that we need to learn, we may be able to open more up, but we don't want to open them up artificially and then have to back it out, right? So we're being really intentional and slow at the beginning because we know that we need to scale really substantially to make sure we have the structure, the process, the resources, the operations around helping everybody move right to left. So in the short term, if you want a definitive, let's get a date dialed in, looking at 2022 is the best way to get that date dialed in. But we are learning as we go, and we will make sure that you guys are not only aware of those learnings, but aware of any type of capacity changes that come in association with that.
We got a question from Ryan Rourke. He just says sold. So maybe we do okay, Sarah.
Perfect.
All right. Let's wait another minute or two, just in case there's any other last-minute questions out there. I will point out that one of the initial technical and operational session that was an hour long or almost was yesterday, and so some of your team members might have participated in that and would have access to that recording. And if not, talk to your account executive, and we can get you access for that one as well. All right. I'm not seeing anything else, so I say we let the executives get back to their busy days and look forward to the next in this series, as well as lots of other conversations around Spring 21. Sarah?
Thanks, folks. Good to talk to you.
Bye-bye.
Bye, everybody.